And what I'd like to spend my time with you this evening is talking about healthcare and the fact that healthcare is not a six-figure word. The costs of healthcare and retirement have gotten this reputation as something that we can't talk about. It's something that has to be set aside from all the other retirement planning that we're doing. And as you'll see throughout this presentation, it may not be the six-figure word that you've been hearing about. So there are three things I want to talk about with the time I have with you this evening. I want to talk about what people hear about healthcare costs in retirement. And then we'll spend the bulk of the presentation discussing what really goes on when it comes to retiree healthcare costs. And lastly, we'll spend a little bit of time talking about what to do about it. Now, as Mary said, if you have any questions, please bring up the chat, put your questions in the chat box. I'll be stopping in a couple of times during the presentation, and Tony, who also helps out with this point forward, will be asking me the questions. I'll do my best to answer them. And please pay attention because there will be some quiz questions as we go through the presentation. So let's take a look. Let's look at what people are hearing about the cost of healthcare in retirement. And I know you all know this because you're the ones who are hearing it. We hear that healthcare costs are enormous. Here are some of the estimates that are out in the media about what will be needed to pay for healthcare costs in retirement. $311,000, $325,000, almost $400,000 is what people internalize as well as the lump sum amount they'll have to pay for their healthcare costs when they get to retirement. Now, not surprisingly, because people hear about these big costs, well, then they end up getting worried about it. When we did some research and looked at the top fears that retirees have about their spending, two of the top three had to do with healthcare, health insurance premiums, and out-of-pocket costs related to healthcare. So people hear it's a big number, they're worried about it, and it's causing problems. Because if everyone thinks that healthcare costs are a big, scary number, a BSN, we end up with some problems. First of all, it's misleading. People are thinking that there's going to be someone knocking on their door the day they reach retirement saying, okay, write a check for all of your healthcare costs today. And when they read some of those six-figure numbers, it's just overwhelming. It's unmanageable. And people look at what their balance is and how much they've saved. They look at these big numbers and go, I'm stuck. I don't know what to do with this. And it limits the solutions that we who are trying to help people make good decisions about planning for retirement can work with them to develop. First of all, as Tanya can attest to, it is really hard to build a financial plan if someone thinks that simply I just have to write a big check the day I retire. It also skews people's perceptions. Because what happens is people look at that big dollar amount and they look at the amount they have in their retirement plan, and that's as far as they get. And we often have people forget about the future income that they might have, like the ongoing Social Security payments that will be flowing into the household. So people start getting a little bit skewed perspective on how these costs are going to show up and what resources they have available to pay for them. Now, fortunately, it's not actually a big, scary number. And I'll give you three reasons why it's not a big, scary number. Reason number one, it's not a lump sum. Nobody shows up at your door the day you retire and says, okay, fill in any cost you're going to have in retirement. Pay for all of it right now. Nobody shows up and says, all right, $150 for internet access every month over 30 years, that works out to $86,000, write us a check today. That doesn't happen. And it doesn't happen with healthcare costs. Nobody pays all of their healthcare costs in full as a lump sum the day they retire. It's an ongoing annual monthly expense that people encounter. So the first reason it's not one of those big scary numbers that you see out there is because retiree healthcare costs are not a lump sum. The second reason it's not a big scary number. Is that you is not we. Those numbers I showed you on the earlier slide, those are for a couple. And yet sometimes they're reported, and very often they're internalized by people as the number they themselves are on the hook for when they get to retirement. And the third, and I would argue most powerful reason it's not a big scary number, is those numbers you saw aren't even remotely average. They are not at all typical. As a matter of fact, the people who put those numbers together actually choose numbers that are designed to not be typical. That number I showed you that was approaching $400,000, the way they came up with that number is they looked at the whole spectrum of costs that retirees pay for medical expenses. And they picked the number that was higher than what 90% of retirees experience for medical costs. And then they took all the expenses people pay, all the different ones for prescription drug costs, and they picked the number that was higher than what 90% of people pay for their prescription drug costs. And then they added those two numbers together, even though that's not the same person. So having a number that 9 out of 10 retirees pay less than is not typical. It's not remotely average. So these are 3 reasons why retiree healthcare costs are not a big scary number, which I recognize begs the question then, if it's not a big scary number, what is it? And that's what this presentation is about. This presentation is designed to help you understand what retirees actually pay for healthcare costs, what's really going on. And to put this together, we have a wonderful PhD researcher who's been doing these kinds of analyses for decades. And he looked at the data set, the health and retirement survey that the Social Security Administration sponsors, to look at what people are actually paying for their healthcare costs. And what I'm about to share with you is the insight you need in order to understand what's really going on. And I'll talk about 3 things. First of all, I'll talk about what retirees spend on healthcare versus everything else that they're buying. The second thing I'll talk about is how much of the healthcare dollar goes for fixed expenses. And then we'll spend a fair amount of time talking about variable expenses, how much people pay out of pocket for healthcare costs in retirement. So let's start with healthcare versus everything else. So for this section of it, it's a little bit different than the description I just gave you. For this section, we looked at Bureau of Labor Statistics data. So the Bureau of Labor Statistics every couple of years goes out and does something they call their Consumer Expenditure Survey. And they ask people what they spend their money on. And this is incredibly detailed. Everything from how much you spend on dairy products to motor oil. And what we did was we looked at what people answered in response to this Bureau of Labor Statistics. Now, the people in this section are specifically Americans over age 75. So we've taken early retirees out of this part of the analysis. We're only looking at people over age 75. And what you see on your screen is that over a third of the expenses for people over age 75 go to this one category. I'm going to bring up a poll and see if you can tell me what that category is. I'm going to make it multiple choice. I'm going to give you 5 options, and they're in alphabetical order: entertainment, food, healthcare, housing, and transportation. So if you would, click on the expense that you think is the #1 expense, encompassing more than 1/3 of expenses for people over age 75. All right, we have our results. Here they are. For those of you who said housing, you're right. And for those of you who said something else, you're close. We'll get to that in a minute. The number one expense for Americans over age 75 is housing. As a matter of fact, that's the number one expense for every age group, from people in their 20s to people over age 75. All right, we're going to move on. I'm going to make the questions a little bit harder. What you see on the screen now are the second and third biggest expenses, encompassing 16% and 13% respectively. So my next question then is, what are the second and third biggest expense categories for the average retiree each year? So same 5 choice options, also in alphabetical order, and I'm going to give you a hint. It's not housing. So what are expense categories number 2 and number 3? All right, this one's a little harder. Here are the results we got. Everybody picked food. And then we've got a mix between the rest of them. Entertainment, maybe, possibly healthcare, transportation. I am impressed that nobody picked housing. I actually have had that happen. All right, so that's what we think are the second and third categories. The correct answer, healthcare is number 2. Food is number 3. And everything else, transportation, entertainment, clothes, all of those other things fill in the rest of the pie chart. So I'd make 2 observations about what you see in front of you. Expenses for Americans age 75 plus. The first observation in the context of healthcare is that healthcare is not the number one expense. As much attention and headlines and chatter that surround healthcare, housing is the number one expense. Healthcare is number 2 by less than half of what people spend on housing, and it's on the order of what people spend on food. Now, there are some people who have difficulty paying for food in retirement, but there aren't that many headlines talking about how much people will need for food or what the lump sum is the day you retire that you're going to have to spend on food in retirement. And yet, for Americans over age 75, they're spending about the same amount on healthcare as they are on food. So one of the takeaways from this slide alone is that healthcare is not some separate category that we either can't talk about or have to deal with separately. It fits into the overall holistic retirement planning that we're all already doing. When we think about how much housing is going to cost and how we'll pay for it, and how much food might cost and how we're going to pay for it, healthcare is right in that same mix. We should be thinking about, okay, how much will healthcare cost and how am I going to pay for it, along with transportation, entertainment, and everything else? Healthcare fits in with all the other categories that we're spending money on. All right, the next thing I want to talk about is how spending changes in these categories between age groups. So I'm going to bring our 65 to 74-year-olds back in for this one. This is still the Bureau of Labor Statistics data. And what I'm going to do is I'm going to compare spending by 65 to 74-year-olds in each of these categories with what's spent by the 75 plus group. So here's what we discovered when we looked at this. First of all, the amount that people spend changes when you go from looking at 65 to 74-year-olds to people who are over age 75. People over age 75 spend more on healthcare than people who are 65 to 74. That's probably not surprising anybody. But what may surprise you is that the spending in all the other categories goes down. And it goes down by far more than the spending on healthcare goes up. And some of this happens naturally, and we've all seen this, that as people get older, well, they're not taking as many trips. They're not going out to eat as often. So it's not that something necessarily happens, although that can be the case, but just organically. spending on these other categories decreases. So sometimes, and it's the reason we have this slide in here, sometimes people get so focused on healthcare and worried about the fact that healthcare costs are going to go up that they're making an assumption that spending on all the other categories is going to be flat, and the healthcare spending just piles on top of that, when in reality, the spending on the other categories decreases by more than what the increase in healthcare is. Now, for the next section of this presentation, I need some help in explaining the concept I'm about to explain. So what I'm going to put in front of you is a deck of cards. What I'd like to do next is talk about probability. So you see a deck of cards in front of you, normal deck of cards. You got in suit order, spades, clubs, diamonds, and hearts. If I were to draw a line where half the cards are to the left of that line and half the cards are to the right of that line, it's very simple. I draw the line at the king of clubs. Half the cards to the left, half the cards to the right. For those of you who are paying careful attention in 8th grade statistics class, we call that the 50th percentile. 50% of the cards are to the left and 50% of the cards are to the right. It's also referred to as the median. That's that formal name for the midpoint. Half the stuff is to the left and half the stuff is to the right. If I were to draw a line where 95% of the cards were to the left of that line, and I'm rounding off a little bit here, just doing it to illustrate the point, I would draw that line at the Queen of Hearts. So all but 2 of the cards are to the left of that line, 95% of the cards, 95th percentile, and then the Queen and King of Hearts make up the other 5%. Now, what's important about this is helping us understand the probability of any of these cards coming up. If I shuffle the deck and pull a random card out, if I get any black card, well, there's a 50% chance that'll happen, and 50% chance that I'll get a red card, and 95% chance that I'll get something other than the Queen or King of Hearts. Which brings me to my next polling question. If I were to take the annual healthcare spending for all retirees, the total amount every retiree spends on healthcare costs each year, and I were to lay them out just like I've laid out these cards, and ask you to tell me what dollar amount is in the middle. What dollar amount is the median, the point at which half of retirees are paying that dollar amount or less for their total annual healthcare costs, and half of retirees are paying more than that dollar amount. So let me bring up poll, if I can get the mouse back. There we go. And this one is multiple choice as well. What is the total healthcare spending for the median retiree each year? Is it $3,400, $6,800, $10,100, or $12,500? The number at which half of retirees are paying that dollar amount or less, and half are paying more. All right, here are the results. And 2/3 of people picked $6,800, and 1/3 of people picked $3,400. The correct answer is, drum roll please, $3,400. 2/3 of people on this call who are probably already familiar with this topic picked a number that was twice as big as what the total annual healthcare costs per person are for the median average retiree. So to continue my analogy, it's as if every retiree each year got a deck of cards, shuffled the deck, and if they got any black card, paid $3,400 or less for their total annual healthcare costs. That's how much they would spend that year. Now, I know what everybody's worried about. It's not that I get one of those black cards, it's that I get the King or Queen of Hearts. That I have an expense that's higher than what 95% of all the other retirees out there are paying for their total annual healthcare costs. The dollar amount at the 95th percentile, if you pull the Queen of Hearts, that dollar amount is $10,100. Neither one of these numbers is a 6-figure number. Now, we'll get to some later on, but when we look at the total annual healthcare spending per person across all retirees, the 95th percentile is $10,100. So that means if I shuffle the deck, again, I get any black card, I'm paying $3,400 or less. I get any other red card other than the Queen or King of Hearts, and I'm paying somewhere between $3,400 and $10,100. It's only if I get that King or Queen of Hearts that I'm paying $10,100 or more. So I'm hoping this is starting to give you a different perspective, other than those six-figure numbers that I showed you at the beginning, about how retirees actually experience healthcare costs. Now, let's get into this a little bit more. One of the things I want to point out is the analogy I've been using fits pretty much for everybody. If I have a year in retirement where I happen to pull a red card, I get a hip replacement or something happens, and I have a spike in my expenses, for the vast majority of people, that's not a persistent increase. There are about 5% of folks who, if their healthcare costs one year go up a substantial amount, it stays high. But pretty much for everybody else, I'm shuffling the deck and pulling a new card out each year of my retirement. So that gives us some insight into healthcare spending versus everything else, and the first part of our presentation as to why healthcare costs are not a six-figure word. So let me pause at this point and see, Tony, if there are any questions that have come in that I might be able to answer right now.
Yeah, hi, Stuart. Yeah, I did have a question that came in. Someone asked, I've heard that whether to get long-term care insurance depends largely on your net worth. Above a certain amount, it's not worth it because you can self-insure. Below a certain net worth amount, premiums are too expensive given your lack of other financial resources. Any thoughts on that?
Absolutely. Thank you for giving me the opportunity to bring it in now, because I was about to. One of the things to keep in mind is that all of the numbers you're seeing do include long-term care costs. And I'm going to dive into that in a little bit of detail about 2/3 of the way through the presentation. So I don't have an exact answer for you. What I do have for you, I hope, is a better understanding of the problem that you're trying to solve. So at the end of this presentation, you will have, I hope, a better understanding of the likelihood of experiencing a long-term care expense and the magnitude, how big that long-term care expense might be. So while I can't tell you what answer would be right for you, I'm hoping that once you see how these numbers play out, and those numbers I just showed you about the $3,400 and the $10,100, that includes what people spend on long-term care costs. And once you understand that a little bit better, hopefully that'll put you in a position where you can make a little bit better decision in terms of answering that question, either for yourself or working with a financial professional who can walk you through the pros and cons of each of those options.
Thanks, Stuart. We have another question that just came in.
Sure.
Are the costs you're describing direct costs for healthcare, or they include indirect costs as well? Indirect costs would be additional, right?
I'll confess I'm not quite sure what, in this context, the term direct cost and indirect costs mean.
I wonder if they're talking about premium costs versus out-of-pocket costs, because...
Got it. So if that's the breakdown, we're about to get into that. Fixed expenses versus variable expenses. What I'm showing is what you as the retiree, or what current retirees are actually paying themselves in terms of healthcare expenses. So for example, if you go to the doctor and you're covered by Medicare, Medicare pays for part of that doctor's fee, depending upon the situation, but you might be paying something out of your pocket as well. What we're talking about here is what you are paying. Does that help, you think? Or I'd invite that person to jump back in the chat box and give us an example of what they mean by direct and what they mean by indirect costs.
Yeah, I think they'll have to jump back into the chat box and ask.
We can come back to it. So let me get into that now. And I'll pause again once I'm done with the fixed expense section, which is fairly short. So we'll come back to it pretty quickly. So we've looked at healthcare expenses versus everything else. Let's start breaking down the healthcare expenses. When people are paying for healthcare costs, let's look at how much is going for fixed expenses. Who's surprised? I was. The vast majority, $3 out of every $4 that retirees spend on healthcare costs are for fixed expenses, essentially Medicare premiums. And this holds, you see up in the corner there, well, this is Medicare parts A, B, and D. We looked at it, looking at if you take Part C, Medicare Advantage. We looked at it if you're a higher income person and you're paying more for your Medicare premium because you're a higher income person. This ratio holds no matter how we looked at it. 3 out of $4 that retirees spend for healthcare costs are fixed costs. It's basically the insurance premium for Medicare. And here's the implication of that. You know ahead of time what about 75% of your medical costs are going to be. It's the healthcare premium. So that's something that you can budget for, that you can work into your plan, just as you're figuring out how much you're going to spend on, oh, say, housing or food. You can do the same thing with healthcare, because for the average retiree, it's 3 out of $4. Yes, sir.
Sorry. Yeah, the person gave us another.
Oh, good.
She said indirect costs. She was thinking of items included with maintaining good health, which would be food, housing, and lifestyle changes. Looks like you separated them separately. They're not part of the healthcare costs, right?
That's correct. So what we're talking about here are medical costs, prescription drugs, and long-term care costs. And if anyone wants to get into the details, that PhD researcher I mentioned has written, I think it's up to 4 white papers now, getting into the details of the elements of what I'm sharing with you. So if you do want more information, we'd be happy to share that with you. So 3/4 of what people pay for healthcare costs in retirement are the fixed costs, budgetable, knowable in advance. That's how you manage it. Told you the fixed part was short. Any other questions at this point, Tony, before I get into variable expenses?
No, not at this point. No other questions at this time.
All right. Variable expenses. These are the ones we're worried about. I mean, Medicare premiums generally just come right out of your Social Security check. So it's not as if you're writing something separate for those. It's when people have to pull money out of their own pockets for the variable expenses that some of this concern comes in. So we're going to look at variable expenses, and we're going to look at it from 2 perspectives. The first is what people pay annually for their out-of-pocket costs. And then we're going to zero in specifically on end-of-life costs. And here we're focusing on that because end-of-life costs tend to be the most expensive period of somebody's life. So we're going to look at the last 2 years of somebody's life. That's how we're defining end-of-life here. So in the research, we were able to find out when somebody passed away, and then we backed up 2 years and looked at how much they spent for variable costs in those last 2 years of life. So we're taking the Medicare premiums out, we're setting those aside, and now we're going to look at what people pay out of pocket for their healthcare costs in retirement. So you're familiar with my deck of cards at this point. We take the spectrum of costs that people have. I'm now breaking it down by age. So we're looking at the annual variable cost for people in their 60s and 70s. And that dollar amount at the median, the dollar amount where half of retirees are paying less than that each year out of pocket, and half of retirees are paying more than that each year out of pocket, that dollar amount is $1,000. For people in their 80s, that dollar amount becomes $1,000. For people in their early 90s, that dollar amount is $1,000. And for people in their late 90s, the median dollar amount is still $1,000. Now, I'm throwing a lot of numbers at you. I realize that. Just be assured, I'm going to put all of this into a table at the end of my deck of cards here. So the first thing we notice here is when you compare people in their 60s and 70s to people in their late 90s, at the median, the dollar amount doesn't change. People in their late 90s pay the same dollar amount at the median that people in their 60s and 70s do. That dollar amount does not increase. Now, I know, again, We're not worried about what's happening at the median, although I hope it's informative to understand what that dollar amount actually is. What people are concerned about is what happens if I pull that king or queen of hearts. So let's go back to our 60 and 70-year-olds and see what happens if someone in their 60s and 70s has an annual variable cost that's higher than what 95% of everybody else at that age group experiences. So at that 95th percentile, that dollar amount is $7,000. In their 80s, people in their 80s, if they have an expense that's higher than what 95% of everybody else who's in their 80s experiences, it's $13,000. For folks in their early 90s, it's $33,000. And for folks in their late 90s, it's $42,000. So again, let me pull all this together in a table and make two observations about the numbers you see in front of you. My first observation, again, is that you do not see the dollar amount that people pay for their annual variable costs increasing when you look across the age bands. At the median, the number at which half of retirees are paying that dollar amount or less is $1,000 for people in their 60s and 70s, all the way up to people in their late 90s. Where you do see the variation is for people in their 95th percentile. We're starting to see some big numbers. This presentation is not designed to tell you that those big numbers aren't out there. They are. It's important at the same time, though, to understand the likelihood of experiencing one of those numbers and who generally experiences them. You see the big numbers generally when people get to their 90s, especially their late 90s. So let me make an important observation here. If we're talking about a 65-year-old, and the 65-year-old is concerned that they might experience that, say, $42,000 that you see on your screen, there are two things that has to happen for that 65-year-old to experience that $42,000. The first thing is they have to experience a healthcare expense that's higher than what 95% of all the other people in their late 90s experience. And the second thing that has to happen is they have to reach their late 90s in the first place. For a 65-year-old male, the odds of them living to their late 90s is about 1 in 4. For a 65-year-old female, the odds are about 1 in 3. Now, I'm combining some things and simplifying again to make a point. But the way you can think about it, if we're thinking about a 65-year-old and their likelihood of experiencing the $42,000 is as if we had two decks of cards, one with blue backs, one with red backs, and they would experience that $42,000 only if they pulled the king of hearts specifically with the red back from the two decks of cards that have been shuffled together. That's the way to think about both the likelihood of a 95th percentile expense combined with the longevity likelihood. So the big numbers are out there. They do exist. The king of hearts with the red back is in that shuffled deck of two decks. At the same time, it's often helpful for people to understand, therefore, the likelihood of it actually happening. Because when we see those headlines, it feels like, oh my gosh, everybody's going to have to pay those six-figure numbers. There are some people who do. We'll get to that in a second. But it's important to understand when it happens and the likelihood of it happening. So that wraps up my section on annual variable expenses. Before we get to end of life costs, Tony, are there any other questions that have come in?
Yeah, I've got another question for you, Stuart. One of the questions someone had, and it gets kind of back to the earlier question in a way, but the amount of housing, when you talk about assisted living or nursing homes or things of that sort, do you tie that into the cost for housing, or you tie it into the cost for healthcare, or does it tie into both?
So if we're talking about money that someone is paying for medical costs, and part of that is wrapped up in where they happen to be at the time, say in a skilled nursing facility, that's part of medical costs.
Okay.
If we're talking about Custodial care, that's not in the medical cost expense. That's a distinction that we've made. And I'll confess, and I'm trying to remember, okay, so if I'm living in a facility, but I'm not getting the medical costs, how much of that was going into housing and the Bureau of Labor Statistics analysis, and how much of it wasn't? Because we used a different database for what you're seeing now, the Health and Retirement Survey out of the University of Michigan, that's again sponsored by Social Security. We're getting into some nuances now where I'd want to call that PhD researcher on the phone and say, let me make sure I've got this right. But what is important is to understand we're separating out the medical expenses, although that does include long-term care expenses. That is in the numbers. So the distinction between healthcare and housing is a little bit different in the pie chart that I showed earlier compared to the numbers we're looking at now.
Okay.
I hope that helped.
We have, yeah, I think it, like you said, some of it gets into the assumptions, whether assisted living, how much of that is considered health related, how much is considered housing. So we got several more questions that came in. So someone asked, well, actually Lynn asked, if the average stays the same and the cost for the 95th percentile increase, does that mean the cost is decreasing from any of the other people being included in the average?
No, and here's why. We're talking about a different kind of average. So when we normally think of average, we think of, I'm going to add all the numbers up and divide by how many numbers I had. That's what we're taught very early on. But this is a different kind of average. There are actually, for those of you, again, paying attention in 8th grade statistics class, there are 3 averages. Remember mean, median, and mode? The first one that I just described, where I add up all the numbers and divide by how many I have, that's the mean. Now that works if your numbers are somewhat similar. If the way they spread out tends to be fairly even. I have the same amount on this side as I have this on this side. It doesn't work very well when you've got most people with one number, I'm gonna do it with this hand, most people with one number, and then a very few people who pay a very large amount. Because then if I add up a whole bunch of people pay 1,000, 1,000, 1,000, 1,000, 1,000, 1,000, and I have literally, hundreds of thousands of people who are paying $1,000. And then I have one person who's paying, I'm going to exaggerate here, but one person is paying $10 million. If I calculate the mean, add all those numbers up and divide by the number I have, I end up with hundreds of thousands of dollars when the vast majority of people don't pay that. Here's how I want you to think about it. I want you to think as if I'm writing down all the expenses that people are paying in retirement on individual playing cards. So what happens is you always have half of people paying $1,000 or less. What's happening is the person who's paying this dollar amount here, that dollar amount for that 5% of people, that dollar amount is what's going up. So it's not as if anything's happening to this, because I'm just spreading out all the amounts people are paying across the deck of cards in front of me. What's happening is the number at the 95th percentile is going up. And because I'm just picking out the card, I got it right, picking out the card that's halfway through, as long as I have half of retirees still paying $1,000 or less, that stays stable. And that's what happens throughout all of the age bands. What's changing is what's going on with these 2 cards here. These numbers are going up, but we're counting how many retirees are on each side of the King of Hearts. I hope that helps. It's a different way of thinking about average. It's the median. It's the dollar amount in the middle where if I count all the retirees on each side, I have the same number of retirees on each side. And what's happening is the person all the way at that 95th percentile, their number is going up as they get older.
Yeah, I think you answered the next person's question. That's what they asked, is the average annual cost summary page, or those average dollar amounts, the mean or the median. So I think you answered that.
That's the median.
Right.
Because when you've got a data set like this, an average just gives people the wrong sense of it. It doesn't accurately represent what the typical person experiences. Now, again, somebody is experiencing that $42,000. That number is out there. At the same time, that's the number that somebody gets if it's higher than what 95% of everybody else is paying.
Okay, we still got more questions coming in, Stuart.
Okay.
So here's one from Sue. Said if a retiree has Medigap coverage and a Plan D, a Part D prescription plan, where does the $7,000 out of pocket come from in ages 60s to 70s?
So we've got a Medigap policy
And a Part D prescription plan.
So what we did is we looked across all retirees, and in one of those white papers I mentioned, our researcher actually looked at these breakdowns depending upon what kind of coverage you had, whether you had traditional Medicare, whether you bought a Medigap policy, what kind of Medigap policy it was. And I'll talk about this at the end a little bit, but what you're doing when you buy insurance is you're basically increasing your fixed costs because you're paying more premium each year, and you're decreasing kind of that tail end, is what it's called, the king and queen of hearts end of the variable costs. So you're making a trade-off there. If you're interested in how those numbers trade off, I'm happy to send you the white paper that details that. I don't have that in the actual presentation, but we did look at what that does. It increases your fixed costs, and it decreases what you might experience for the variable costs. And that's what insurance does for anything. We pay a premium to the car insurance company so that I'm not on the hook in case I have a high expense with my car.
Exactly. Okay, we have one more question from Jean that says, how likely statistically is it that a person will need custodial care in the various decades? For example, my parents have a live-in caretaker in their 80s. Had a live-in caretaker in the 80s, I'm sorry.
Yep, it's a great question, and I'm going to address that at the end of my end of life section, because that's something everybody can think of. We can all think of somebody who is paying a high dollar amount for custodial care, for long-term care. So we've explicitly put that in the presentation. Give me a minute to lead up to it so people have the context, and I'll address that exactly.
Okay, I think, Stuart, that's all the questions we have for now.
Okay, thank you for the questions. This is great. All right, let's look at variable expenses at end of life. So again, the most expensive part of someone's life when it comes to healthcare costs, and we're looking at the last 2 years of life. So before we were looking at just 1 year, now we're looking at the last 2 years of life. So I'm gonna, as you see, start shortening how I share the numbers with you. Here we're looking at those variable costs by age of death. So for people in their 60s and 70s, at the median, it's $3,000. And people in their 80s, the most expensive part of their life is $4,000. In their 90s, $5,000. We're seeing the same patterns emerge. There is not that much difference between what people in their 60s and 70s pay compared to what people in their 90s pay. And at the median, so for half of retirees, it's a fairly modest amount. We're all worried about the 95th percentile. Here it is. Finally, we finally have our six-figure number. For end-of-life costs, last 2 years of life, for people in their 90s who have an expense that's higher than what 95% of all the other 90-year-olds experienced in the last 2 years of their lives, we do have a six-figure number. It's $114,000. Now, the bulk of that number, and I'll get into this in a minute, is long-term care costs, not actually medical costs. And when you think of medical costs as what am I paying for medical treatment in the hospital for my doctor, the vast majority of that $114,000 is long-term care costs. But let's focus on this end-of-life variable cost here for a second. So again, at the median, fairly modest amount, doesn't go up all that much by age band. At the 95th percentile, that's where we start seeing the differences, and that's where we start seeing the $114,000. The other thing I want to make reinforce is that longevity aspect again. If we're looking at a 65-year-old and talking to them about the likelihood that they'll experience the $114,000, conceptually that's the equivalent of mixing up two decks of cards in front of them and they'd only experience it if they pull the King of Hearts with the red back. If they pull any other card, they'd be paying less than the $114,000. That's one of the ways you can think about this. And the other thing I want to do is break this down by gender. And the same pattern holds. At the median, there's very little difference between what males, even in any of these age bands, and females pay for end-of-life variable costs at the median. Half of males and half of females would pay less than the numbers you see here. Where we do see distinctions, and you're going to anticipate it by now, is at the 95th percentile, especially for people in their 90s. There we see almost a $20,000 difference between what males and females pay end of life if they have an expense that's higher than what 95% of every other 90-year-old is experiencing. And again, most of that is long-term care costs. So since we've spent a lot of time talking about long-term care costs, that's the same pattern right there, let me zero in on it. Here it is. In the final 2 years of someone's life, when we look at long-term care costs specifically, so I'm taking medical costs out of this now. This is just long-term custodial care. The average median retiree at every age band pays $0 in the last 2 years of their life. As a matter of fact, it is $0 at the median, all the way through their 80s. The 75th percentile. So this is a 50th percentile. At the 75th percentile, the dollar amount is $0 all the way through the 80s, and then the 80s and 90s, it's in the single thousands. It's like $3,000 or $4,000, which means somebody takes a deck of cards, and if they pull any black card or any diamond out of the deck, up until their 80s, they're paying $0 for long-term care costs, and then a fairly modest amount in their 90s. Where we do see the big numbers, again, is 95th percentile late in life. So the $114,000 for long-term care costs is somebody who's in their late 90s and is having a long-term care expense that's higher than what 95% of every other person in their late 90s experienced in terms of long-term care costs in the last 2 years of their life. So here's the observation I'd make, because I know what everybody's thinking. Everybody, including me, is thinking, but I can think of somebody who's in that category. I know somebody who's paying a very large amount of money for long-term care costs. So one of the things that I'd ask you to recognize is that that example we can think of can be thought of as the exception that proves the rule. Of the literally hundreds of thousands, perhaps millions of people in their 90s, we can think of one person, maybe two people. If I were to ask you to think of 20 or 100 or 1,000, it would be very hard for any of us to come up with that. So we all can certainly think of somebody who has that experience. Those numbers are out there. There are people who pay those dollar amounts. At the same time, it's important to recognize the likelihood of it happening and when it happens. So we put this long-term care slide in here to address exactly the question that you brought up. The idea that, well, my parents or I know of somebody who's paying these large dollar amounts, help me fit that knowledge that I have, that experience I have with that into all these other numbers that I'm seeing. And I hope this slide helps you do so. That for the vast majority of people, it's $0 that are paid for long-term care costs in the final 2 years of life. There are some people, the unfortunate few, who end up pulling that King of Hearts with the red back, or for people in their late 90s, the Queen or King of Hearts, when we're talking about the 95th percentile. And for that small number of people, they are paying a fairly large amount.
So Stuart, getting back to the question then, what about long-term care insurance? What do you say in terms of that?
So I don't know enough about any person's particular situation to be able to say you should do this or you should not do that. again, what the presentation I hope is designed to do is to help you have a better understanding of, generally speaking, for retirees, the likelihood of these expenses and what they might be. And then you perhaps working with a financial professional directly who can take into account all the factors in your particular situation can help you decide what the right solution might be. And I've got the section at the end covers solutions. I'll talk about them a little bit, but it's not as if I can make a blanket statement that says this is the right answer for everybody. Hopefully, though, this is giving you a better understanding of the problem you're trying to solve.
Yeah, another individual said, seeing this slide, I wonder why anyone would buy long-term care insurance.
So it's a personal choice. I mean, there are all kinds of insurances that were offered, and we make decisions about which ones to take and which ones not to. And if you understand the numbers, hopefully you're in a better position to make that decision about what to do and what the consequences may or may not be. Other questions?
Yeah, I have another one that just came in. It says, doesn't your presentation also make the point of long-term retirement planning to plan against those catastrophic events, those 95 percentiles that might cause us to outlive our investment savings / savings, or that might prevent us from leaving a legacy to our families?
Sorry, I didn't quite catch the question part of that.
I think the point that the person was making was that you lay out this scenario, but and I'm assuming this is going to get in your next part of your presentation, was okay, so how do you protect against the fact that you might be that person who falls into the 95th percentile?
Right. Okay. Yes. Let's take a look at what to do about it. Sorry, I've got one more section in here, which addresses exactly what that person just brought out. So let me dive into that problem for a second, and then I'll get to the solutions. Because the issue they're bringing up is, will healthcare use up all my money? I mean, if I'm planning on leaving a legacy, but it uses all my money, then I'm stuck. So let's take a look at this. Now, one of the things that I want to make clear to everybody is who we included in this analysis and who we did not. It's very explicit, or rather important in this section. But if you think about, let me even go back to this slide right here, specifically long-term care costs. When we did this analysis, there's a really important group of people that we did not include in our analysis. And the people we did not include in our analysis of long-term care cost spending, and therefore some of the other medical costs that you saw earlier, healthcare spending, is we did not include people on Medicaid. And those of you familiar with Medicaid already know why we excluded them from our analysis. Because people on Medicaid don't pay for long-term care costs. By definition, if they're on Medicaid, any long-term care costs that they experience are paid for by the state. And therefore, if we were just looking at people, we'd have a whole bunch of zeros in terms of what the people were paying for their long-term care costs if they were on Medicaid. So what you're seeing on the slide here, and then in all the other slides, and especially, it's especially important in the section I'm about to get into, is we're looking at people who are not on Medicaid. So to qualify for Medicaid, depending upon the state you're in, you can only have so much in assets, you can only have so much in income. It's generally very low numbers. So we're talking about very poor people who are on Medicaid. Their long-term care costs are paid for by the state. So we're looking at people who are above those thresholds. That's who is included in our analysis. Folks who aren't paying for their own long-term care costs, we did not include. And it's important when we talk about whether or not healthcare will use up all of someone's money. So what we have here is the percentage of net worth spent at the end of life. So basically what we did is we took the dollar amount that someone spent at the end of their life and we divided it by what their net worth was when they died. And similar to the pattern you saw earlier, 2%, 3% at the median what people spend at the end of their life uses a very, very small percentage of their overall net worth. Now, this is especially important when someone is thinking about, if I have a spouse or a significant other or partner, or I want to leave a legacy to other beneficiaries, what's going to happen when I die? Will healthcare costs take all of my money when I go? Or will I take all of my money with me? At the median, it's low single digit percentages. For somebody who has an expense at the 95th percentile at the end of their life, if it's in their 60s or 70s, it's 40% of the net worth, which means 60% is left. 60% of their net worth in their 80s, 40% is left. And let me explain the 135%. How do you spend more than you have? That tends to be people who are just above the Medicaid line. So they aren't poor enough to qualify for Medicaid, but they still end up with one of those 95th percentile dollar amounts. So while they're receiving that care at the end of their life, the cost of that care actually recedes the very modest amount of resources they actually have. It wasn't low enough to get on Medicaid, because then the state would have paid for their long-term care costs, so we did not include them in the analysis. The 135% tends to be experienced by people with very modest means who, again, unfortunately, ended up with one of those 95th percentile expenses. All right, so that's the end of that section. Let me summarize here and then talk about some solutions. But I'll pause first to see if there are any more questions that come in, although I may defer until I get to the solutions section. But here's how retirees actually experience healthcare costs. It's not a big, scary number. It's not a check you have to write the day you retire. It's not the largest retirement expense. It's an annual expense, really monthly. When you're thinking about Medicare premiums, most of it is fixed. Most of it is the premium you're paying for Medicare that's just coming out of your Social Security check before you even get it. Now, of the variable out-of-pocket costs at the median, it's a modest dollar amount for all age bands. At the same time, a very few people will experience high costs. Those six-figure numbers are out there. But it's important to understand the likelihood of experiencing them and when they occur. It generally doesn't happen until people are in their 90s, very much their late 90s. So that's hopefully what you've learned about how retirees actually experience healthcare costs. I do want to talk a little bit about what to do about it, but Tony, let me pause again and see if there are any other questions that have come in.
None at this point, Stuart. I think some of the questions come in after the what to do about it. I think that's where people are really focused on now.
All right, so now that I've either scared you or unscared you, depending upon how you're taking this, let's talk about what to do about it. So first, understand the situations, understand the costs, and that's what this presentation is about, the fixed costs and the variable costs. The other thing to understand is you. What is your personal situation? Again, it's part of the reason I can't give a direct answer to the question of, well, do I buy long-term care insurance or not? You know, one of the things to consider is who's on your wellness team. If something were to happen to you, is there a spouse or significant other? Are there family members who might be in a position to support you if you need it? Or is that not the case? Is there an advance directive in place? What are your wishes, and have you expressed them about what kind of end-of-life care you may or may not want? And what are your personal circumstances? And this can include things like how you value insurance. Is it more important to you to pay a higher premium for insurance so that you don't have to worry about the king or queen of hearts, or knowing the likelihood you've decided, you know what, that's not important for me. I'll deal with it if it does happen to me, but the likelihood's small enough that that's not something I feel like I need to take care of right now. So it's not just about understanding the cost, it's about understanding you as a person, your situation, and what's important to you as you're prioritizing these things. That puts you in a position to assess potential solutions. Now, there are three I'm going to talk about here. The first one is funding, and that is not just how much money do you have. It's not just what you've saved. It's about all the resources you have, including whatever sources of income you have in retirement. So When did you or do you plan to start Social Security? You get the biggest Social Security benefit at age 70. So if you have one of these expenses later in life, you've got a bigger check. Every month that you start your Social Security benefit before age 70, that Social Security benefit is reduced for the rest of your life, and depending upon your situation, may be reduced for your spouse's lifetime if you predecease them. So one of the things to think about is, what decisions do I make with Social Security? The other thing to think about for your savings is not just how much do you have, but what accounts are they in? So most of us have pre-tax accounts, traditional accounts, 401k, IRA, money that when we withdraw it will be included in taxable income. But there are two other sources of money that you might have that are important to think about in the context of healthcare costs in retirement. The first one is a Roth account. A Roth account, if you make a qualified withdrawal, that money is not included in taxable income in retirement, which means if you have a year where you get a red card and you have a spike in expenses, if you pull all the money you need for that spiky expense out of a pre-tax account and include all of that in your taxable income that year, it could put you in a higher tax bracket. You might pay more of your Social Security benefit might be taxable. You may pay more for your Medicare premiums. On the other hand, if you have a source of money where you don't pay taxes on the withdrawal, like a Roth account, you might be able to avoid all those consequences that might happen if all that money came out of a pre-tax account. The third account to think about is a health savings account, an HSA. Now, not everybody has those, but if your employer has offered a certain kind of medical plan and there's an account, a health savings account with it that you can put money in, if you make a qualified withdrawal from that health savings account, like to pay for Medicare premiums or medical expenses, that money is also not included in your taxable income, also like the Roth accounts. So one of the things to consider for your situation is, where have I been saving my money, and where for the future savings do I want to direct that money to help me manage what I might or might not experience in retirement? If all of my money is in pre-tax, then any withdrawals are going to be included in taxable income in most cases. If I have money in Roth, if I have money in a health savings account, that gives me other accounts to draw from that might not be taxed if it's a qualified withdrawal when I have these expenses in retirement. The second area to think about is investments. If I could potentially experience these bigger expenses later on in life, am I invested in something that's giving me enough potential growth that later on in retirement, since most of these big numbers show up in my 90s or late 90s for people, do I have enough growth along the way that I'm potentially building up enough assets as I go along to have that to draw from? And the third area, as I've talked about a couple of times, is insurance. How do I feel about buying a Medigap policy where I'm paying a higher premium, but then some of those variable costs are taken on by the insurance company? How do I feel about long-term care insurance where I pay a higher premium and some of those bigger long-term care expenses might be covered by the insurance company? So thinking through all three of these, how much money do I have and what accounts are they in? How am I investing? And do I have the potential growth that I might need? And how do I feel about my insurance options, and what kind of trade-off am I willing to make between premiums and what benefit I might get from the insurance company? All of those, I hope, are at least a little bit easier to make given your understanding now of what it is we're trying to address. Now, let me go through about 2 more slides, and then I'm done, and I'll take as many questions as people have. One of the things that it's helpful to look at directly is your retirement plan. See if your employer offers a financial wellness program, because that can give you some resources to think about budgeting and emergency funds and the other kinds of things that are helpful to put people in a position where they've got a better level of confidence about where their money is going and what they might spend it on. We have a visualized retirement program that is sometimes helpful. In your retirement plan, especially when you get into retirement, what kinds of withdrawal options does your employer allow you to have in your retirement plan, or what do they offer and allow you to withdraw? Is there a systematic withdrawal option? So if you want to take out a steady amount along the way to help with the ongoing medical expenses, you have that option. Is there some kind of ad hoc withdrawal option where you can just call up and say, I need X dollars because I've got an out-of-pocket expense I need to cover, just send me the X dollars. So looking into what the withdrawal options for your retirement plan is an important part of being prepared for this. The accounts I mentioned, is your employer offering a Roth account where you pay taxes on the money going in, but then if it's a qualified withdrawal on the other end, it's not included in taxable income? Is there a medical plan that has an HSA with it? And does it make sense for you to choose that for your current medical needs? And then if so, are you taking advantage of the HSA in the best way possible to meet your medical costs today, as well as put some money away for the retiree healthcare costs that you may encounter in the future? And then again, what investment options are available in your retirement plan to allow you to have the potential growth that you might need to take care of your expenses today and the expenses you might have down the road. In sum, this is not a one-time decision. It's not as if you're making a decision at age 65 for your healthcare costs and you're taking care of it then and it doesn't come up again. It's something you're going to be dealing with every year. You're going to adapt. You'll reevaluate everything. What I hope has happened is that this presentation has given you more information and made you more confident that you're prepared to handle whatever may be in the cards for you. So thank you very much. I hope this was informative. We've got about 15 minutes left at the end here. Tony, if there are any other questions, I'd be happy to entertain them. Thank you all very much.
Thank you, Stuart. Thanks for a great presentation. Yeah, we have a few other questions that we'll start asking you. One question is, what are your thoughts about annuities as part of the overall planning for healthcare and costs in retirement?
Yeah, again, unfortunately, I'm not in a position to say yes or no to any particular tactical solution. There's so many other things for you to think about that are specific to your situation that I wouldn't be able to give you an answer about anything specifically. Again, look back at the information I've shared. If you're interested in some of the white papers to help you understand it in more detail, I'm happy to share those with you. What we're looking to do with this presentation is give you a better understanding of what the problem is, and that helps you assess the solutions for your individual situation, hopefully from a more educated standpoint.
Okay, so yeah, some of these other ones are more specific.
And I understand that.
One person said, I'm just beginning to learn about the topic. We have to buy Medigap, don't we? We need to have something besides Medicare.
Again, that's your choice. When you say have to, that implies either some kind of legal obligation. It is your choice as to whether you want to purchase a Medigap policy. So understanding how retirees are now experiencing healthcare costs hopefully puts you in a better position as to whether or not you want to make that decision.
Okay, another one is our current HSA money that we can continue to use or access once we decide to retire?
The answer is yes, that once you put money into a health savings account, that money can be used for any future medical expense that you might encounter. So if I put $100 in an HSA today, and in however many years, 30 years, I have a medical expense, I can take that money out. And if it's a qualified medical expense, it's not taxed when I make the withdrawal. And while the money is in the HSA, I can choose how to invest it. So that's part of where that potential growth comes in. Now, one of the other things to remember about an HSA is when you pass away, if the HSA account gets left to anybody other than your spouse, the money in that account counts as income to that non-spouse beneficiary in the year you die. So one of the benefits of an HSA is if you withdraw it for qualified medical expenses, you pay no taxes on that withdrawal. On the other hand, if it's left to a non-spouse beneficiary, then that money is considered taxable income to them in the year you die. And one of the tax benefits of an HSA, therefore, doesn't get used if that happens. So when you're using an HSA, bear in mind that particular rule. So if you're saving the money now, you're going to use it later on. It kind of speaks to using HSA money earlier in retirement to make sure it does get used for those qualified expenses, and you do get to take advantage of that tax benefit.
And I guess one of the limitations of an HSA is for the most part, it can't be used to pay for premiums.
HSAs can be used to pay for Medicare premiums.
Right.
There are other premiums that cannot be used for. So as you're going through this process, and again, financial professionals like Tanya help people all the time understand the details of these issues so that when you're making a decision for yourself, you've got it with all the important information that you need.
Okay. Now this next one is pretty similar to one we talked about a few moments ago with the annuities, but it's what about the hybrid life long-term care insurance, which pays beneficiaries at death what is not being used for long-term care expenses? I guess they're asking your opinion on what you think about them.
And you're going to get the same answer. And part of that is, while you cannot see them, I can hear my legal department sitting on my shoulder saying, you cannot give people advice on a particular product. So again, it's understanding the problem you're trying to solve, and then that puts you in a better position to evaluate the pros and cons of any particular solution that you might be considering to help solve this problem.
Okay, I don't see any other questions, Stuart. So before we wrap up, I'm going to turn it back to
Stuart.
Yes.
Yeah, if I might ask a question rather than type it in, which might be a little bit lengthy. So I was interested in your median healthcare costs at $3,400. Is that based on the median income of $31,000?
It doesn't take income into account at all. We looked at the total annual total annual cost. So premium and out-of-pocket spending for all retirees. And when you look at all retirees and look at the lowest amount up to the highest amount, and you draw the line where half of retirees are on this side and half of retirees are on that side, that dollar amount is $3,400. So it's completely agnostic as to what any of those people might actually have as income. It's just what they spent on medical care. So if I can bring that slide up. Does that answer the question? You're talking about this
I
number,
suppose.
right?
I am, and I was just wondering if again, 2019 average median income is 31,000. Is there a sliding scale? Is what I was thinking. Is if you're living on 100,000 a year, would you triple that number?
This number represents all retirees. So we didn't look at, the only place we looked at anything related to what you're talking about is the percentage of net worth that was spent. So that's when we divided it by someone's asset level. So this is just what people spent on medical costs from the lowest amount to the highest amount. This is the number in the middle. So there are lots of things that might affect how much a particular individual might spend on medical costs, but we didn't get into that for this analysis. The 3,400 is just the number in the middle. We didn't look at what someone's income might be. Am I addressing what you're asking? I'm not sure I am.
Yeah, I suppose it just seems like that number is very low in my experience, and that, you know, again, if you're looking at median population of 340 million people in the United States, you know, probably the majority of that is at the lower income spectrum, and perhaps they're not spending as much on healthcare, bringing that number down. Whereas maybe that's there's a different number for higher income people, and what we might expect to see based on income levels.
And that's where understanding each individual's personal situation comes into account. What I invite you to do is you can get in touch with me. I'm happy to send you the white papers behind this that delve into a little more detail. Again, we really don't get into too much of the income, but we may have some more details in there that might help give you a little bit more information for what you're looking for.
Yeah, you may be referring to IRMA, which hits a lot of people on the higher income level under Medicare, which raises the rate much higher than what you got here.
Well, again, we're for a specific individual, yes, because then we're looking at how many people are in each one of those. For those of you not familiar with it, the way Medicare premiums are set up is if you make above a certain dollar amount, you pay a higher premium. So it gets into, okay, there are people paying higher premiums than a bunch of other people, but there are fewer of them. And again, this is where hopefully the presentation helps you understand what's going on in the aggregate, hopefully a little bit different than the idea that everybody has to pay $400,000 the day they retire, and starts you down the road of exploring what might be your personal situation and what you can be doing today to prepare for it.
Okay, two other comments, questions came in, Stuart. One was, actually a third one just came in as well. One is people wanted to know how to get a copy of the white paper. And I think you mentioned that already.
Mary, I'll leave that up to you. At this point forward, I'm happy to share them with you guys, and you can share that with anybody who signed up.
We can send them out with a follow-up email from this if you want to send them.
Okay, happy to do that.
Okay, and then two other questions came in. One is, what percentage of 65-year-olds will likely need long-term care?
That's not something we got into in terms of if I put 52 or 100 65-year-olds in the room, what percentage of them will need some kind of long-term care. There's also a difference between need long-term care and have to pay for the long-term care myself out of my own pocket, and the distinction between that and how much will I personally have to pay out of my own pocket for long-term care. Give me a second. Let me see if I can get to, again, that long-term care slide. No, I went too far. So when people say, what are the odds of me needing long-term care? There's a distinction between I need long-term care and I have to pay for long-term care and how much I have to pay for long-term care. So I just remind everybody there's all that. We didn't look at the likelihood of somebody needing long-term care. What we looked at was, are they paying? And if so, how much are they paying? So summary of that here on your screen. And I apologize for referring to the white paper so much, but we did delve into that so you can get more detail on that in those white papers.
Okay, great. Stuart, thanks again for a great presentation, for the audience participation. It was really well done.